Hello, everyone. After a great deal of research, I have identified a patient simulator application for my iPhone, and it is called Prognosis, Your Diagnosis. It was created by a medical doctor from Sri Lanka, and just wanted to kind of show you there are multiple versions of this application. There's emergency medicine, cardiology, neurology, many others. So I went ahead and downloaded all of them just so that we could pick one. So I think that I think it would be interesting to check out this cardiology prognosis app. So let's go to cases. And I haven't played this one yet, so this is kind of new for all of us, but let us check out a case. How about, unexpected. Play case to reveal. Okay. So we got a 58-year-old man who complains of fever for 3 weeks associated with fatigue and lassitude. His medical history is unremarkable. He has never undergone any surgical or dental procedures and used recreational drugs. There is no family history of malignancy. A chest x-ray and urinalysis are found to be normal. So we can examine him. Lungs clear. Apex beat is normal. He has a little bit of a murmur. He looks ill, pale. I mean, he's not icteric, no swelling. He's got some clubbing. All right, so let's investigate this a little bit further. So we can run some exams, some testing. We can do a full blood count. I think that is worth doing. His white blood cell count is elevated. His H&H is a little bit low, and his platelets are high. So close that. Do we need blood cultures? I don't know, but I think echo is probably something that we need. So the echocardiogram shows an oscillatory mass attached to the mitral valve with concomitant mitral regurgitation. There are no structural cardiac defects. The left ventricular ejection fraction is 63%. I feel like I read somewhere that maybe that's a little low, but don't quote me on that. So, and let's see if we need any. I mean, we could do blood cultures, because what if he did have some kind of growth on his heart? Because I know that that's a thing. So we'll click that. Let's see. He does have gram-positive VE cocci in 2 samples, and they've isolated Streptococcus bovis. So close that. I really don't see a need to perform a colonoscopy, so I'm going to skip it. Let's go to manage. I think that he does need some IV antibiotics. I think NSAIDs are probably important, although because his platelet count's pretty high. And then I don't know what that bacteria is, so I'm not really sure that he needs anti-tuberculosis treatment, but I'm not really sure that it wouldn't hurt, so I'm just going to do it. And then let's check out our results. So I think I'm really finished. Yes. Oh, I've done poorly. Let's see why. So I did not do a colonoscopy, and I gave antibiotics, but I did not need NSAIDs or the tuberculosis treatment. And my explanation is because I didn't even see that he had a fever, but this is saying he had a fever. He's got the murmur. It's got positive, so IE, I'm not even sure what that is. His echocardiogram demonstrates this mass on the mitral valve leaflet, so it causes cardiac vegetation. And so there is a well-recognized relationship between S. bovis infection and the presence of gastrointestinal neoplasia, as carcinoma of the colon may cause occult GI blood loss resulting in iron deficiency anemia. His mandates colonoscopy in this patient. His colonoscopy shows that he has a mass in his sigmoid colon, and it's most likely malignant. So, yeah, I was way off. That happens as a student for sure. But, you know, it's also good because now I know this, and I can use this in my practice when I start seeing things that resemble these types of symptoms in clinical representation. Oh, and it says that, yeah, so infection of the endocardial surface. And I was thinking endocardial infection. And it says that if it's not treated, then it can be fatal, which is scary. And then it shows some of the risk factors. We get some of the symptoms. You get some of the testing that should be involved, which is great for learning. And then, oh, look, it talks about Duke University and a type of criteria. And then it gives us some take-home messages, which is pretty great, you know, just some highlights of the case and the etiology. Tells us that it's very uncommon, and, you know, these are symptoms that are likely in the majority of patients. And then, you know, some indications. And then we also have references. So looks like perhaps this is a little bit evidence-based. So I like this. This is a pretty interesting tool, and I'm excited that I got to share it with you in my patient simulator application video. So I hope you enjoyed it. Bye.